Perfect. Hi, everyone. My name's Iwan. I'm a final year medical student at the University of Oxford. And today I'm presenting the sort of interim results of a quality improvement project that I've been working on for the last year. And what we've been aiming to do is improve the undergraduate teaching of pain management at the University of Oxford. So as a background, pain, as I'm sure you'll all know, is one of the most common presenting complaints in medicine and is almost ubiquitous in the hospital. It represents a key determinant of patients' quality of life, but it's also often an important diagnostic indicator when we're determining what condition a patient might be presenting with. And what we know is that pain is taught throughout medical school, given that it's so prevalent, but medical students often lack teaching that's dedicated solely to pain and its management. And what we know is the result of this is that there's a lack of confidence among junior doctors in communicating to patients about pain, and also in the practical skills of prescribing analgesia to patients. And despite being a leading medical school, we know that the University of Oxford lacked a dedicated programme of teaching on pain and its management. And that's something that within our quality of improvement project, which consists of a consultant in pain, a specialty registrar, and 4 medical students, has been trying to address. So the aims of the project. Our project has tried to introduce teaching across the whole of the 6-year medical programme at the university, mapping the current curriculum to that proposed by the International Association for the Study of Pain, which is very comprehensive. For early year students in the preclinical course, we've aimed to teach them about pain physiology and pharmacology. And then for clinical students who are spending time in the hospital, to introduce them to the key concepts relating to pain that they'll need when they graduate, including analgesia, including practical prescribing guidance, communicating to patients about pain, both acutely and chronically, and then other concepts such as addiction, which are traditionally not taught very well in medical curricula. We also want to know how best to deliver this teaching to our students. In terms of the structure of the project, the idea was generated by a consultant at the John Radcliffe Hospital in Oxford, who noted that medical students didn't feel comfortable with the practical skills of pain management, but also in communicating to patients about pain. This led to a proposal for a comprehensive curriculum at the university in agreement with the medical school. In terms of the interventions that we've introduced, which I'll discuss on the next slide, we conducted a literature review, a focus group, and identified this IASP curriculum and compared these to gaps in the current teaching at the university. Where we are now is that we're introducing multimodal interventions and implementing those throughout the medical school to hopefully work out which ones of those are sort of felt by students to be most effective in improving their learning. And once we've measured the outcomes, we'll repeat the process to improve our teaching in future. So pre-intervention, we identified limitations in the existing curriculum through 3 methods. So the first was a literature review conducted by my colleagues to find what methods of teaching on pain and management are felt to be most effective at medical school. Comparison of this IASP curriculum to existing teaching. And finally, a focus group of 48 clinical students, mostly students in their final year. So they had experience of the whole course and understood where the weaknesses were. And actually, of those students, they unanimously felt that pain teaching could be improved at the medical school. And many of the areas of weakness in the course that they identified matched those that were missing from the existing curriculum as identified from the IASP curriculum. One of the main interventions that we've introduced, which is what I've been working on for the last year, is a pilot lecture and seminar to be delivered to new clinical students in their 4th year of training as they enter the hospital for the second part of their course. The lecture and seminar covering sort of basic topics that students should know once they're on the wards. So this is pain assessment and history taking, addiction, analgesia, and then also practicing some clinical scenarios so they feel comfortable communicating to patients in pain. We recorded responses from the teaching sessions on a Google form that was sent to students, recorded on a 5-point Likert scale from 1 being strongly disagree to 5 agree. And I'm only able to present some preliminary data because the teaching is ongoing, and actually we only had our first session yesterday, but hopefully in the future we'll have some more complete data to present. So we have responses from 30 respondents so far. And what we know is that the students enjoyed the lecture. They felt that it was appropriate for their level of training, and that it was relevant to their medical education. And actually, I've just been having a look through some of the data this morning, and what's encouraging is that they felt that their confidence improved throughout the session. But actually, even before the session, they felt that it was something that would be important to understand better. And I've just got a few of the data represented in pie charts on the right of this slide. And as I said, the seminar is currently being delivered to students in small groups of about 15. And what we're hoping to see is that students benefit both from the lecture, which gives them an overview of the clinical concept, but also from the seminar, which is more interactive and will give them a chance to practice some of the skills in communicating with patients. In terms of the other interventions that we've introduced, we've updated the MedEd booklet. So this is medical education booklet given to students at the start of clinical school, which is a guide to history taking and examination. So it covers all of the sort of medical and surgical examinations, as well as how to take history. And what we've pushed for with the medical school is to include pages on how to assess patients in pain, including numerical and visual scales, and then also some tips on prescribing analgesia. Last year, we also delivered a pilot seminar to a small group of final year students. These are students who finished their final exams and are going to become junior doctors. And what we tried to do in this seminar is give really practical advice on how to prescribe analgesia, contraindications, and things that they should be aware of when they are prescribing for patients. And these students unanimously felt that the teaching covered significant gaps in their knowledge and increased their confidence in pain management. Which is fantastic that we're introducing teaching that students feel is beneficial, but shows that a traditional curriculum is not preparing students well enough for managing patients in pain once they graduate. We're also working alongside the medical school to introduce a chronic pain case in the Patient Doctor 1 course. And this is a course for first and second year students where every month they go to a GP practice and they meet an expert patient tutor who will discuss their chronic condition with the students. And we felt that it was important for students to have exposure to chronic pain, which is something that students often lack at medical school. Some of the challenges of our quality improvement project. Firstly, has been working alongside the medical school to fit new teaching within the confines of a tightly filled curriculum. And this has required a lot of back and forth and negotiation with the medical school. And so I think if anyone is hoping to do something similar at another medical school, it's important to get the hierarchy of the medical school on side so that they understand the importance of your teaching and see that what you're doing is adding to the curriculum and not threatening it. The second challenge is how to provide students with practical experience, because we know that pain and its management, it's all well and good to know the pharmacology of analgesia, but that's useless if you don't know how to prescribe for patients. So what we're hoping to do in future is provide some more practical sessions so students feel more comfortable in a clinical scenario. And then thirdly, the financial and time resources required to introduce new teaching programs. And at the moment, we've relied heavily on the goodwill of consultants and registrars to provide the teaching. But obviously in future, if this is to become an established part of the curriculum, we will need to find ways to recompense people for the time that they're giving to deliver this teaching. But overall, we're really excited by the progress that we've made. We can see that we're having an impact on students' education, and hopefully this will lead to people feeling more comfortable dealing with patients with pain or supporting patients in pain, not only at medical school, but once they graduate. And it's a really important thing that doctors do feel more comfortable with. And these are some of the references from my presentation. Thank you very much. I'll stop sharing my presentation now. I'm happy to take any questions.